Hello, everybody, and welcome back to Pathogen Pointers. It's been quite a while because I was moving, but we are now settled in at the new house. I started my new job, so hopefully I can start making YouTube videos again. So, as I mentioned, this is Pathogen Pointers. In this series, we do a deep dive into a specific veterinary pathogen or group of pathogens and look at how it affects multiple species. Today we're going to be doing a broad overview of the major fungal pathogens in our veterinary species. So there are a wide variety of fungal pathogens that can affect our veterinary species, and they usually affect the respiratory tract or the skin. However, there are some more truly pathogenic fungal pathogens that can be systemic if they reach circulation and are able to disseminate throughout the body. So when we think about our fungal pathogens, we kind of divide them into two groups. They're either pathogenic or they are opportunistic. Pathogenic organisms can establish an infection in a normal host, whereas opportunistic organisms primarily affect immunocompromised animals or immunosuppressed animals, where there's some sort of underlying problem with the animal that allows the fungal infection to actually proliferate. So we're going to start with Aspergillosis. Aspergillosis affects almost all of our domestic animal species, and it primarily causes respiratory infections. Aspergillus fungi are ubiquitous in the environment, and they're also commonly found as an environmental contaminant on our diagnostic tests. So this means that if you want to confirm a case of aspergillosis, you typically have to demonstrate tissue invasion, either on histopathology or by testing tissues that should otherwise be sterile, in order to confirm that there is a diagnosis of aspergillosis. As I mentioned, it primarily causes respiratory infections, and so animals usually acquire the infection through inhalation of those fungal organisms. And we most commonly see these aspergillosis respiratory infections in birds. Clinical signs that you might see include dyspnea, fever, nasal discharge, and coughing. And at postmortem, you can often see yellow nodules or plaques throughout the respiratory tract that are actually the fungal mats forming within that tissue. We can also see aspergillosis associated with placentitis. So usually in this case, the fungal spores enter through the open cervix during breeding, leading to contamination of the uterus. We primarily see this in cattle and in horses, and typically this results in abortion. So usually the mare or the cow will show no other signs of fungal illness, but they will abort, and you will see on postmortem a sort of thick, leathery placenta that often has this pseudomembrane that you can peel off. So in the horse world, another thing that we think about with Aspergillus is guttural pouch mycosis. So this is infection of the guttural pouches with the fungus. And the reason this is so significant is that the fungal plaques can actually erode into the carotid arteries. So because of that, one of the main clinical signs we think about is severe epistaxis or nosebleeds. And it's from that fungus actually eroding into the arteries, causing massive bleeding. Prior to an epistaxis event, you may see clinical signs like dyspnea or nasal discharge, but in many cases, that nosebleed is kind of the first clue you ever get that there is guttural pouch mycosis there. On postmortem, you can see that fungal membrane or plaque within the guttural pouch, and that can help you confirm the diagnosis. We can also get aspergillosis affecting the eye, so mycotic keratitis is infection of the corneal surface. We most commonly see this in horses, and it's usually after we've been using glucocorticoids in the eye to treat other conditions. And what this results in is basically these non-healing or melting corneal ulcers that can be quite significant and quite painful for the animal. In our dogs and cats, we usually think about aspergillosis as affecting the nasal cavity and sinuses. So associated clinical signs would be sneezing, nasal discharge, and again, epistaxis. Somewhat interestingly, the fungus can actually erode through the cribriform plate, which is a very thin layer of bone between the nasal sinuses and the brain. And so if that happens, we can see CNS signs and fungal meningitis due to the extension of that fungus into and around the brain. And finally, aspergillosis can cause systemic disease. So we mainly see this in dogs, and what we can see clinically is lethargy, lameness, muscle wasting, fever, lymphadenopathy, and neurologic deficits. So these would all be things you would associate with some sort of systemic infection. On postmortem, we'll see these granulomatous lesions often affecting the lymph nodes, spleen, vertebrae is a very important one, as well as other organs. I mentioned the vertebrae specifically because discospondylitis is common with these Aspergillus infections, and so sometimes that can be the only clue that you have that this dog has systemic aspergillosis. Next, we'll take a look at blastomycosis. So blastomycosis primarily affects dogs, cats, and horses, and it's usually found in river basins and around waterways. Usually animals acquire the fungus by inhalation, and once it's inhaled, it then disseminates and causes systemic disease. There are cases where the fungus has actually entered through wounds, so that could be another potential route of infection. So when we look under the microscope at blasto, one of the key features that we often describe is what we call broad-based budding. So basically this means that the fungal spores look like a snowman. So if you look at this image, you can see that there's sort of a larger blob on the bottom and then a smaller blob on the top. That's this broad-based budding that we often describe as a characteristic feature of this pathogen. Because it's primarily a respiratory infection, we do see clinical signs like dyspnea with harsh lung sounds, fever, cough, weight loss, and lymphadenopathy. And keep in mind, because it can spread systemically, it's usually going to end up spreading to the eyes, bone, and skin. Because blastomycosis can have sort of a variable presentation, you want to think about it in cases where you have draining cutaneous nodules, lung nodules on the thoracic rads, lymphadenopathy with fever, lameness with bone erosion visible on radiographs, or cases of neurologic disease. Next up, we have Candidiasis. So Candida is a normal inhabitant of the respiratory and GI tracts in many species, which means that when we think about it causing infection, they're primarily going to be opportunistic infections. We usually see Candida infection in birds as well as immunosuppressed animals, and it can either affect the oral mucosa or the GI tract or both. In our poultry species, it primarily affects the crop and esophagus, and it produces these circular white ulcers with thickening of the mucosa. And on top of those ulcers, you often see a peelable pseudomembrane. Other clinical signs that you might see include decreased feed intake and decreased growth rate. For our other species, Candida infections are usually associated with prolonged antibiotic or corticosteroid use. When it does affect these animals, we usually see it affecting the oral mucosa or any parts of the intestinal tract that are keratinized, such as the squamous parts of the stomach in horses. One of the most characteristic findings is a white pseudomembrane on the tongue that you can see here, and other clinical signs you might see may include diarrhea or anorexia. Next up, we have Coccidioidomycosis. So Coccidioidomycosis primarily affects dogs, and it's most common in arid and semi-arid regions within the southwestern United States. This pathogen is usually inhaled by the animal, and then goes on to cause respiratory disease and may spread systemically. Under the microscope, we see it as these spherules that often contain endospores, and so that helps differentiate it from blastomycosis, which would have the snowman shape. Again, because it's a respiratory infection primarily, we're going to see clinical signs like cough, lethargy, inappetence, fever, and tachypnea. And if it spreads systemically, we primarily see fungal infections in the eyes, bones, brain, and skin. Cats are somewhat unique with coccidioidomycosis because rather than respiratory infections, they tend to get more cutaneous infections. So in these cases, we'll see things like draining skin lesions, subcutaneous masses, abscesses, fever, and weight loss. Next up, we have Cryptococcosis. So Cryptococcosis primarily affects cats, And the fungus itself is common in soil and bird feces, particularly pigeon feces. Cats acquire the pathogen through inhalation or through contamination of wounds, and depending on the way that it entered the body, it will either cause respiratory or cutaneous disease. Under the microscope, these guys do narrow-based budding, so rather than forming a snowman, they pinch off much more tightly, and so you get two kind of blobs of equal sizes rather than this snowman shape. When cats get cryptococcosis, it's primarily found in and around the nasal cavity, so clinical signs include things like sneezing, nasal discharge, polyp-like masses, and swelling over the bridge of the nose. When cryptococcosis affects dogs, it primarily disseminates and it causes disease in the eyes and CNS. So clinical signs you might expect in a dog would include circling, paresis, seizures, and even blindness. Next, we have histoplasmosis. Histoplasmosis is most common in dogs and cats, and again, it's common in bat and bird feces. We primarily see this in the Mississippi and Ohio river valleys, and animals acquire the infection through inhalation, and then the fungus can disseminate to other parts of the body. We primarily see it causing respiratory disease, and under the microscope you'll see narrow-based budding, and often the spores are actually found within macrophages. Generally, the clinical signs for this disease are nonspecific, so it's going to cause things like weight loss, fever, pale mucous membranes, and peripheral lymphadenopathy. If it does spread systemically, you may see things like draining skin lesions, ocular signs, or CNS signs. When dogs get histoplasmosis, they commonly develop gastrointestinal disease, which may present as chronic diarrhea. When we do necropsies on these patients, we can often see thickened or hemorrhagic intestines. And you can also see associated conditions like hepatomegaly and ascites due to histoplasmosis infection in dogs specifically. So similar to blasto, because this one can cause a wide variety of conditions, you want to consider histoplasmosis in cases of unexplained weight loss, chronic diarrhea, respiratory distress, identifiable pulmonary nodules, or cases with enlarged lymph nodes. Next, we have Oomycosis. So oomycetes are actually more closely related to algae than to fungi. However, the way that they cause disease more closely resembles fungal disease. We typically see this in horses and dogs. However, it can affect any domestic animal. Usually, affected animals are in tropical and subtropical areas, and they often develop skin or gastrointestinal disease as a result of infection. Cutaneous pitheosis is particularly common in horses, where it forms these large ulcerated nodules, and then within the nodules are these mineralized areas that people call chunkers. Usually these wounds or nodules are found on the legs, chest, lips, and abdomen, or areas where the horses are most likely to be exposed to water. We primarily see enteric pitheosis in dogs, but it can occur in horses as well, and it causes clinical signs of gastrointestinal disease such as vomiting, weight loss, and anorexia. And often these animals don't appear systemically ill until very late in the course of the disease. If we get these in at postmortem, we can see thickening of the intestinal wall and lymphadenopathy. Finally, we have Candidiasis, which is caused by Legenidium, I can't say this one, Legenidium giganteum, and this disease primarily affects dogs, and it causes these skin lesions on the extremities. However, there is sort of a unique systemic involvement of this condition where we can see lymphadenopathy, but also great vessel aneurysms. So in these aneurysms, there are these large outpouchings of these vessels, and if they are left unmanaged or untreated, they can lead to rupture and sudden death. So this is kind of a unique presentation of fungal disease specific to Legionidiosis. Finally, for our major pathogens, we have Sporotrichosis. So Sporotrichosis has been reported in many species, and it usually results from wound contamination that then leads to infection. The unique thing about sporotrichosis is that you can get zoonotic transfer from cats to humans, and so that's one of the unique things about sporotrichosis is that you can get zoonotic transfer from cats to humans, even from cats that don't otherwise show signs of disease. In our veterinary species, we usually see lymphocutaneous and disseminated forms of this disease, with lymphocutaneous being the most common. So in that lymphocutaneous form, we see these firm nodules in the dermis or subcutaneous tissues at the site of inoculation, and from that site, the infection spreads along the lymphatic vessels, causing a corded appearance and further nodules along each of those lymphatic cords. In cats, we most commonly see lymphocutaneous disease occurring on the head, especially on the nose and the pinnae. Just to wrap up, I have a few miscellaneous fungi that also come up that you should probably know about. Dermatophytosis is primarily caused by Microsporum and Trichophyton species, and it affects all species of animals. It's spread by direct contact with an infected animal and results in these patches of hair loss, scaling, and pruritus. This one is particularly notable because it is zoonotic, so you can get ringworm, as it's called, from our veterinary species, as well as you could transfer it to one of your veterinary patients. I am not even going to attempt to say this name, but it is a mycosis caused by Basidiobulus and Candidiasis species, and we usually see it causing ulcerative nodules on the mucous membranes of the nose and mouth. And it does appear really similar to Pithiosis and Candidiasis, but we can differentiate between them on histopathology. Epizootic lymphangitis is caused by a specific type of histoplasma called Histoplasma capsulatum farcinosum, and we see this disease in Africa, Asia, and the Middle East. Usually it's affecting horses and other equids, and what happens is that there's some contamination of a wound, and then we see formation of cutaneous nodules on the legs, neck, chest, and face associated with that wound site, or even distant to that wound site. Hyolohyophomycosis is caused by non-pigmented septate molds, and it primarily affects our dogs, cats, and horses. Animals acquire this pathogen through wound contamination or inhalation, and from there they can either develop a local infection or disseminated disease. On the other hand, phaeohyphomycosis is caused by pigmented septate molds, and again affect a variety of our veterinary species. And we typically see it presenting as ulcerated cutaneous nodules on the digits, pinnae, or on the nasal planum. And again, you can see systemic dissemination. So I just mentioned both pigmented and non-pigmented septate fungi. Both of these types of fungi also have a special presentation called a mycetoma. If it's a black grain mycetoma, it's usually from a pigmented mold, whereas if it's a white grain mycetoma, it's usually one of the unpigmented molds. And basically these mycetomas are just subcutaneous or cutaneous nodules that may ulcerate. And what's happening is that there are mycelia proliferating within that nodule, and those mycelia organize into grains, which are kind of firm pieces of tissue. And you can often find those grains within the exudate that's coming out of that nodule, or when you take it off and you cut it in half at necropsy, you can also see the grains there. Finally, we have Malassezia. So these are yeasts that normally inhabit the skin and mucosal surfaces, but can occasionally cause clinical disease. We typically think about this infection in dogs, where it causes things like otitis and dermatitis. And under the microscope, it has a characteristic shoe print shape on cytology, which helps with identification. So this is just a summary table to wrap up sort of the main pathogens we talked about and what you should think of when you think about each of those pathogens. So feel free to use this for your own studying purposes. Thank you for watching Pathogen Pointers. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there's also a link in the description where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.